Hey, Dr. Jones here. Today, we're diving into an important topic that affects millions of women. We're talking about uterine fibroids. If you've ever experienced heavy periods, pelvic pain, or bloated and wondering what's going on, this video is for you. We're going to define fibroids, discuss who's at risk, common symptoms, and what to do if you think you have fibroids. So, let's get into it. Fibroids, or the fancy name or the medical term is leiomyomas or myomas, are noncancerous growths that develop in or on the uterus. They can vary in size from as small as a seed to as large as a grapefruit. And I've got something to tell y'all. I have recently been diagnosed with fibroids, and I've never had fibroids before. And according to ACOG, up to maybe about 70% of women will develop fibroids by age 50, though many won't have symptoms. Now, fibroids can occur in any woman of reproductive age. Some groups are at higher risk, and women like myself, Black women, we are disproportionately affected, developing fibroids at earlier ages and experiencing more severe symptoms. Here's a few other risk factors: family history of fibroids, hormonal influences, obesity, high blood pressure, and vitamin D deficiency. So, let's talk about a few symptoms. Some fibroids are silent, causing no symptoms at all. But when the symptoms do appear, they can significantly impact your everyday life. And the most common symptoms are going to be heavy or prolonged periods that lead to anemia. That's low hemoglobin. You can have pelvic pressure, frequent urination if the fibroid is pressing on the bladder, constipation if the fibroids are pressing on the rectum, painful sex, low back pain, bloating, or an enlarged abdomen. And if any of these symptoms sound familiar in yourself or your friends or someone that you know, it's time to take action. If you know someone who's experiencing these symptoms, or if you are having these symptoms, don't ignore them. Here's what you do next. Track them. Note the severity, the duration, what makes them better and worse than any other patterns. Second thing you do is make sure you contact a healthcare provider who can do a pelvic exam and maybe even order an ultrasound or an MRI to confirm the diagnosis, basically being able to see them on some type of imaging studies. Now, there are some different procedures you can go through. Make sure you talk to a GYN about it. But above all else, make sure you're maintaining a balanced diet. Make sure your vitamin D levels are normal. And make sure you talk to somebody about the symptoms that you are going through. If you have any questions about fibroids, drop them in the comments. I'll do my best to answer. And don't forget to follow me for more women's health insights, more medical questions. Make sure that you stay informed, stay empowered, and take charge of your health. I'm Dr. Erica R. Jones, MD, and I am a board-certified family medicine physician. When I tell y'all that getting a diagnosis of having fibroids opened my eyes, it really, really did. So I gotta tell you, make sure that if you are feeling like your periods are off for whatever reason, you go and get checked. It's Dr. Erica R. Jones, MD. Take care.